Have you ever noticed tiny shapes drifting across your field of vision? These shapes, often appearing as specks, strands, or cobwebs, are known as eye floaters. They seem to dart away when you try to focus on them, making them a bit elusive. Rest assured, these floaters are not external objects or figments of your imagination. They are actually located inside your eye. While they can be a bit bothersome, eye floaters are generally harmless. Their scientific name is muscae volitantes, which translates to flying flies. This name aptly describes their tendency to move around within the eye. Floaters are more noticeable when you look at a bright, uniform background, such as a clear sky or a white wall. Floaters can be a common occurrence, particularly as we age. However, a sudden increase in floaters or any other unusual visual disturbance should always be checked by an eye doctor. Understanding what causes floaters can help us appreciate both the complexity and the occasional quirks of our visual system. Section 2. The science behind floaters. To understand eye floaters, we need to delve into the anatomy of the eye. The eye is filled with a gel-like substance called the vitreous humor. The vitreous humor helps maintain the eye's shape and allows light to pass through to the retina. Floaters occur when tiny clumps of protein or other cellular debris form within the vitreous humor. As light passes through the eye, these clumps cast shadows on the retina, which is the light-sensitive tissue at the back of the eye. Our brain interprets these shadows as the shapes we perceive as floaters. The floaters appear to move because they are suspended in the vitreous humor, which shifts slightly as the eye moves. The tendency for floaters to be more noticeable against bright backgrounds is due to the way our pupils react to light. In bright light, our pupils constrict, making the light passing through the eye more focused. This focused light casts sharper shadows of the floaters onto the retina, making them more visible. Section 3. The blue entoptic phenomenon. In addition to the more common dark floaters, there is another type of visual phenomenon you may have experienced: tiny bright blue dots that seem to dance rapidly across your vision. This is known as the blue entoptic phenomenon, and it has a different cause than typical floaters. The blue entoptic phenomenon is caused by white blood cells moving through the capillaries in front of the retina. White blood cells, also called leukocytes, are slightly larger than red blood cells and can momentarily block the flow of blood in these tiny vessels. The space behind the white blood cell, filled with plasma, appears as a bright blue dot. These blue dots are usually very small and difficult to see unless you are looking at a bright, uniform background. Sometimes you might even notice a faint tail trailing behind the blue dot, representing the column of red blood cells following the white blood cell. Section 4. The significance of visual phenomena. Eye floaters and the blue entoptic phenomenon, while seemingly insignificant, offer a glimpse into the intricate workings of our visual system. These phenomena highlight the fact that our perception of the world is not a direct representation of reality, but rather a complex interpretation by the brain based on the information it receives from our eyes. Our brains are remarkably adept at filtering out these common visual disturbances. We often become accustomed to the presence of floaters and barely notice them. However, any sudden or dramatic change in our vision should never be ignored, as it could be a sign of a more serious underlying condition. By understanding the causes and significance of these visual phenomena, we gain a deeper appreciation for the complexity and wonder of our own bodies. These fleeting glimpses into the inner workings of our eyes remind us that even the most mundane aspects of our existence can hold profound beauty and scientific intrigue.